At this time, it's my privilege to introduce Grace Hilario to today's meeting. She has been a registered nurse for over 10 years and has a background in healthcare management, stroke and cardiac programs, intensive care, and outpatient military healthcare. She works at Corona Regional Medical Center as the stroke and chest pain coordinator. She always strives to ensure high-quality medical care is provided to the community. Please welcome Grace Hilario.
Hello, good morning. My name is Grace Hilario.
And I'm Silvia Bolanos. I'm the critical care educator here at Corona Regional.
First off, thank you so much for allowing us to speak at the chamber. We wanted to discuss a few items such as heart disease, early heart attack care, and a potentially life-saving device that would quite be beneficial for your businesses. First off, I'd like to discuss heart disease. Heart disease continues to be the #1 killer in America. In comparison to COVID last year, COVID was the #3 cause of death in America. #2 was cancer, and #1 is still heart disease. So I wanted to ensure that we are all aware of how big of an impact heart disease plays in our roles. And we want to make sure that people are aware of the statistics. Approximately 1 in 4 people die of a heart attack every year. So that's approximately 750,000 people in the US dying of heart attacks every year. In women, it's more prevalent. So it comes out to about 1 in 3, and it comes out to about 1 woman dying every minute of a heart attack. We wanted to ensure that people are aware of the signs and symptoms of early heart attack care that we would need to intervene. For example, chest pain, shortness of breath, feeling of fullness, jaw pain, excessive fatigue, anxiety, nausea, vomiting. So it's a number of factors that might potentially lead to a heart attack. So we want to ensure that the public is aware of what to do in the case that you need to intervene. Sometimes with women, it can show various symptoms such as just nausea and sweating. So we want to make sure the women are aware of when to come into the hospital. I also wanted to share a short clip of video from a team of experts.
I look healthy. I look super healthy.
I look healthy. But things can change in an instant.
Sudden cardiac arrest knows no age limit.
It can strike anyone at any time. Even kids.
Would you know what to do if I was suddenly unconscious?
Would you only call 911?
Or would you nearly double my survival chances?
Just by using an AED.
You can't tell by just looking at me.
But I have a cardiac condition.
I may need an AED, but someone has to know how to use it.
AED stands for Automated External Defibrillator.
It can save someone's life if their heart changes rhythm and stops pumping blood.
And it's not hard to use.
The first thing you should do is call 911 if someone collapses and is unconscious.
Call 911.
Get the AED and start CPR if necessary.
Make sure you know where the AED is and how to access it.
Time is important. Once you have the AED, turn it on.
Unit okay.
There will be step-by-step instructions right on the device, and you'll hear voice prompts.
Stay calm. Check responsiveness.
Attach the AED pads to the skin on the chest.
And then to everyone to stand clear. Stand clear.
Don't touch patient. Analyzing.
The AED will tell you if the person needs a shock.
Shock advised.
If it tells you to shock, make sure nobody is touching the person. Then, press the shock button.
Shock delivered. Start CPR. Continue CPR.
After that, the AED will tell you to continue CPR until help arrives.
Or deliver another shock if necessary.
Shock advised.
Congratulations.
You may have just saved a life like mine.
Or mine.
Or mine. Because kids like me need lifesavers like you.
Great, Great, thank you for showing that video. So the reason why we showed this video is because it is very important to not misconstrue that heart attacks only happen to the elder population. About 1 in 5 people under the age of 65 do suffer from a sudden cardiac arrest. So it really can happen to anyone. We can go to the AED information session. So Sylvia will discuss the AED portion on our mannequin and how to utilize it.
So first of all, if you see anyone who collapses, first thing that you need to know to see if they're unconscious, so you can tap them on the shoulder and ask them if they're okay. If there's no response, if you know how to, you can check and see if they're breathing. Just by looking at their chest. If you know how to, again, you can check their pulse. But if you don't know how to do either or, if they are unconscious, they do recommend that you begin CPR. So the area where you would do CPR, you look at the middle of the nipple line, and then you would cross your hands like this, and then you press firmly onto the chest. You have to go down about 2 inches. And, you know, the rate is usually 30 compressions per minute. The beauty of AEDs is that they are now provided in the vast majority of businesses, at the mall. We even will have some AEDs in our parking lots in areas where we don't have a defibrillator readily available here at the hospital. But the AED takes away the having to think about how fast should I compress, or what are my next steps. So you definitely want to make sure that you call 911 before you start compressions, so that you can get specialized care and you're just, you know, not the one person taking care of someone who's unconscious. So you would start CPR and then call for someone to get the AED. We have a training AED here. It does give you prompts. So first thing that you need to do is turn it on, and the on button looks like any single, you know, any machine's on button.
Adult patient.
And then
The patient is a child.
it has an adult and a pediatric setting. So
Remove
this is
clothing from the patient's
an adult.
chest.
You would have to remove the clothing from the
Remove
patient's
packet and apply pads
chest.
onto patient's bare skin.
And then it has instructions on where the
Apply
pads go.
pads as shown in the pictures.
And the AED gives you prompts.
Remove packet and apply pads onto patient's bare skin. Press pads firmly on skin.
And then it tells you to press them firmly to make sure that they're
Press
fully
pads
there.
firmly on skin. Do not touch the patient.
Now you would-
Analyzing heart rhythm.
You would have to stop the patient so that the
Do not
AED can
touch the
analyze.
patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear.
So before you shock the
Press
person,
the
you need to make
flashing
sure everyone has stopped touching the
Press
patient.
the shock button.
And then
now.
it'll start flashing.
Shock delivered. Begin CPR.
And then you, after the shock is delivered, you would have to start CPR. As you can hear, the AED starts
10.
counting for you. That way you don't have to think about how often you should do compressions.
20.
And then after it, you finish the 30 compressions, it'll analyze the rhythm again. And then it'll tell you whether you need to shock them again or anything like that. So it kind of buys the person time. Survival rates definitely go up once you use an AED or start compressions early, rather than just waiting for the ambulance.
Yes. So we just wanted to kind of explain the importance of the AED. Currently, 88% of heart attacks occur outside of the home. So if you decide to implement an AED program into your business, it's stated that about 34% of businesses implement the AED, and 66% have found them successful. So we did provide some resources here with a QR code. You can go ahead and take a look at the various types of AEDs there, and they'll provide you with different types, and as well as a video from the American Red Cross on how to utilize it. So thank you so much for your time. We appreciate it.